DSI Africa, Aisha sits in a home office.
Hi, everyone. My name's Aisha Walcott-Bryant. I'm a research scientist and manager at IBM Research Africa, based right here in Nairobi, Kenya. I'm happy to be here with everyone today, and I'll speak about or highlight a few key projects that we have done around healthcare in Africa, leveraging cool technologies, including AI, data science, and more. So looking forward to having a further follow-up with you all.
Aisha opens a presentation.
My talk today will be on AI innovations to transform healthcare in Africa.
The first slide displays a world map.
Just to give some context, I work at the Nairobi lab, and I'm a part of IBM Research. And we have over 3,000 researchers in our labs across 6 continents, many different locations. And while we look at challenges and innovations relevant to our context, we leverage the strengths of each other from a technical perspective to address these challenges. So even though we are based in Africa, we leverage the strengths and the technologies developed from our colleagues in the labs across the globe. So here at IBM Research Africa, we have a very rich healthcare profile, definitely motivated by challenges on the continent and opportunities on the continent. However, these are definitely scalable across the globe. So you'll see a flavor of global health when you think about research for healthcare, at least the examples that I provide today. So this gives you a high-level idea of some of the domain areas within healthcare that we are focusing on, including disease intervention planning, maternal, newborn, child health, improving those health outcomes. This tool called the Digital Health Wallet, which is around consent managed and sharing and exchange of healthcare data. Cancer Mapper, and that's a cool technology that is able to support those who are doing coding, ICD coding for pathology reports. TB genomics, so using machine learning to understand drug-resistant TB, and family planning. And that's really around understanding contraceptive discontinuation for different populations on the continent. Today, I'll highlight the first 2 on the top.
1. Disease intervention and planning, and 2. Maternal, newborn, and child health.
And then I'll actually use the third one,
Digital Health Wallet,
just as an example of collaboration and partnership with the local ecosystem. So let's talk about disease intervention planning, and let's use the use case of malaria, because it's something that's very endemic in many of the countries in Africa. Every 30 seconds, 1 child dies from malaria globally. And more than 90% of malaria cases occur in sub-Saharan Africa. And in 2018, there was reported 400,000 deaths that were due to malaria. I think the key about this is the fact that malaria can be treated with anti-malarial drugs, and the transmission of the disease can be prevented with effective malaria control. And we've seen this over time as the parasite has been with us since prehistoric times and on other continents. So there are measures that we can take to help to eradicate the disease. Our perspective as researchers with a background more on the computing side was to look at the malaria control problem to support the decision-making process and to support policymakers. Policymakers and decision-making teams for malaria control generally have some targets. They want to reduce mortality, they want to eradicate malaria in certain regions, reduce prevalence, and so forth. But at the same time, they have a set of constraints, budget, the supplies, and many others. Now, there is a rich community in the malaria modeling space that have developed many different models for malaria, including intervention models that allow you to see what is the what if, what is the potential future state of the world if you do this set of interventions. And such interventions are things around spraying, so IRS, so indoor residual spraying of different households and buildings, larviciding, distributing nets, and there's many, many others. But now you can see for a decision maker that needs to eradicate malaria, they have a range of options at their disposal. And not only that, it actually ends up being a very huge complex space in the sense that what proportion of the population should receive nets, and how much larviciding should be done, and how many households should be sprayed. So just that mix and combinations of interventions makes this problem actually very rich and complex from a computational perspective. At the same time, while these malaria models already exist, these decision makers need to be able to consume the outputs of these models and not be experts in modeling. All right, so our aim really is to say, how can we leverage these models that already exist, use AI techniques, and support the decision maker? So here on the right, you see again the malaria model.
The model of malaria intervention displays a series of possible intervention steps at different points in the life cycle of the parasite that can be interrogated by AI.
But as it turns out, we can actually pose a problem that takes the outputs of these models and allows for an efficient way to explore the range of interventions a policymaker can do for their location. Now, this problem, again, the models are rich and complex, and actually generating samples from the models is computationally expensive. And then the search space of all possible intervention plans is vast. But as I mentioned, AI methods are actually well suited for these types of problems and these types of technical challenges. So at the very bottom, we show a common AI method or framework called reinforcement learning. And this allows for different algorithms to explore an environment. In this case, it's going to be a malaria intervention model. Try different actions in this environment, and then look at the future state of the world based on their goals. So perhaps it's they want to reduce mortality, then they want to find future states of the world in which they reach their lowered mortality targets. So what's very interesting about posing the problem this way is now it's making those models accessible to policymakers and also accessible to the AI community, bringing the AI and the disease modeling community together. So if we look at this example here,
using AI methods to explore malaria interventions.
We're just showing two different actions.
1. Insecticide-treated nets, and 2. Indoor residual spray.
That can potentially be explored through using different AI methods. And you might have reward functions that are cost per DALY averted. So DALY is disability adjusted life year. And so basically you want to have some type of costing mechanism that reduces that, or it could be prevalence in others. And again, as I mentioned, there's many different types of models.
Such as the Liverpool Malaria Model, STEM, MASH, and Optima.
So from our framing of this problem and working closely with domain experts, so this work is actually in collaboration with the Bill and Melinda Gates Foundation, we've been able to apply some newer methods in AI to this domain. And we found here on the right, if you look at this plot, you see two lines or two curves. One is a blue curve and one is a yellow curve or orangish curve. Both of them leverage different types of methods within the reinforcement learning domain. But if you notice, the orange curve actually reaches this red line. Let's say your red line is the prevalence. So you want to reduce prevalence to under 6%. So the orange curve reaches this line much more quickly than the blue curve. So that's a different method. And it basically says you can take multiple steps of decisions to reach your target versus one step, i.e. deploy nets and spray all at this one time, and then that's it. So this one says, okay, let's allow for some flexibility in your intervention program to say you can deploy nets now, you can then do larviciding later, and then you could do another range of interventions. So now you've got a multi-step intervention plan. What we found through this work is that we actually found intervention programs that hadn't been considered before. And so really we want to bring out a set of tools for decision makers to be able to access that, leveraging compute and AI. And the final takeaway is that this orange curve, there are samples in which you actually get a lower cost. So the cost is on the x-axis, and a faster time to prevalence by using these methods. So I think for us, finding, understanding this problem, finding different methods to address malaria control specifically, and then also leveraging the capabilities of bringing communities together from the AI community and also disease modeling community, we're now seeing new techniques that will hopefully accelerate our progress to this global health target of malaria eradication. An example case study that we are actively working on is generating new malaria intervention programs to reduce prevalence and minimize deaths in Uganda. And so Uganda's decision makers, they have a set of goals, and their goals are that by 2025, they want to drive the malaria parasite prevalence in all 134 districts of Uganda to 5% or less. Now you can imagine how complicated that can be, because every district might have any number of, any level of prevalence. And they might have environmental factors and various populations. So how do you reach this target is the key open question, and the question that we are pursuing leveraging AI methods. Another case study, which is very familiar to all of us, now if you think about it, I talked about malaria. This is actually scalable to other disease domains, and to be honest, to other domain models. So any scenario in which you have a model and a set of actions in which you can change the potential future state or the outcomes of the models. So let's think again. We are all in a global pandemic. The question is, how do we generate intervention programs to reduce the spread of COVID-19? You've got private sector, public sector, and various COVID-19 task force teams.
With targets such as local containment, limit economic disruption, reduce mortality, and constraints such as budget, health system resources, among others.
You've got all these common interventions that you all are hearing about and we're all adhering to. That's why I'm doing this remotely, and such as staying at home and school closing. So again, how do we leverage the models, these different interventions, and the local geographies to develop the best intervention program that will reduce the spread of the disease? So that was giving you a flavor on how we can start to develop techniques and tools to address disease intervention planning by leveraging artificial intelligence. And from there, all of this is ongoing work. So you can imagine, we're developing a platform, scaling it to multiple diseases. We focus on one at a time, working in collaboration with partners who are domain experts, such as the Bill and Melinda Gates Foundation, and then also the partners on the ground. So this cannot work without their input and without the reality of the on-the-ground understanding in the African context, in our case. I'll give one other example from our healthcare research. And this one is really on maternal, newborn, and child health. And how do we improve those health outcomes? So just as some background, 99% of all maternal deaths are actually occurring in developing countries. 47% of all child deaths under the age of 5 years occur within the first 28 days of birth. So that's essentially neonatal mortality. And then there's a 15 times higher mortality rate for children under 5 in sub-Saharan Africa than in higher income countries. But again, majority of the maternal, newborn, and child care deaths are actually preventable. So how can we help understand with technology how to identify these vulnerable populations? Working again with the Bill and Melinda Gates Foundation, we have identified common sets of questions, and I'll highlight one here. Can we identify subpopulations of mothers and children who are disproportionately susceptible to poor health outcomes? So whether it's maternal mortality or child mortality. Now let's use an example of an existing data set from Africa, the demographic and health surveys. Very common surveys that have been done, I think, since the 70s to now, periodically across many, many different countries. So you can actually leverage this data set and do some exploration on this data set to explore one of the questions that I had mentioned there. So a good example here is doing stratification, a very common method to really try to tease out and understand who are these vulnerable populations and who's having these poor outcomes. In Nigeria, it turns out that about 13% of the mothers have experienced the loss of a child under age of 5 in Nigeria, and as of the 2018 survey. So if we do stratification by region, you can clearly see here that the brown line, the Northwest region, has a much higher under 5 child mortality of about, let's say, 18% or so, whereas the Southwest region has 7.5%. But that's by picking by hand the location. And really the big question is, well, what combinations of household factors and mother features have drastically increased odds of under 5 mortality? And on the opposite side, which households and family features have more positive outcomes? So the way we did it is we applied an AI search method around automatic stratification. So now it's not that you have to pick each variable and try to understand the subpopulation, but instead we're able to use these AI methods to understand the vulnerable subpopulations. So in this case, using this algorithm, we found that a subpopulation that had mothers with greater than 3 births in the past 5 years and also resided outside the South-South region were 2 of the key characteristics for a vulnerable population. In this case, this population actually had a 48% under 5 mortality. And that's huge. That's like, nearly half of the women, right? And it covered more than about 20% of the overall mortality. So this nugget, this ability to find this unique combination, this unique subpopulation, is extremely important and valuable for targeting the right types of interventions and for even understanding them. On the positive side, we have, that's my daughter, we have the protected subpopulation. And the protected subpopulation, this is actually the common features were mothers with 1 birth in the past 5 years, mothers who were less than 40 years old, and mothers residing in a household of size 3 or larger. So the combination of those 3 happen to have a much better under 5 mortality, down to 4%, much different, right? But again, this represented about only 14% of the entire population. So I'll just give a quick hint on the method and then, refer you to some references on it. But really, again, we're looking at a number of these features, right?
Such as region, wealth index, household size, mother's BMI, and mother's age group.
And for every feature, they can have a different value. And you want to look at all combinations of features and values to find that population that is furthest away from the average in this case. And so this method actually leverages some cool AI methods for efficient search. It exploits some interesting properties such that you don't have to look through all combinations, which would be computationally infeasible, to efficiently find the most anomalous subpopulation. So I'll just kind of wrap up those two project areas and then give you some context from a collaborations perspective. So in the disease intervention planning, this work we've actually done locally here and run some competitions to get folks in the AI community and the malaria modeling community to leverage some of the tools that we've developed and explore and learn with their algorithms. So that's through deep learning in DABA, and then more broadly in NeurIPS and KDD. So some other application areas I had mentioned is the COVID-19. And then for the automatic stratification, once you find that subpopulation, you can actually start doing targeted intervention planning. But you need to know what levers can you pull that will have the biggest change in the outcome. And with that, we're building a suite of data science tools for population health that can help inform those decision makers on that side. So for collaboration, I mean, none of this is possible without collaboration and without the ability to work with the local ecosystem and partners. In our case, we do a number of different things. We will visit the domain experts to go to healthcare facilities and also go to run workshops, do design thinking, give talks, technical talks, work with universities that are on the ground. So there's lots of different ways that we have to engage to address these very complex problems. And actually I have one example that I'll show you with one slide before I wrap. So we've done some work in the health systems space, and really it's really around on the data side. So how do we allow for data that perhaps is being collected by a community health worker, so it's not necessarily in a clinical setting, and data that's also collected within the clinical setting? How do we allow that patient-centric view so that you can see both types of data and not necessarily a disease-centric view either, and bring this data forward for healthcare providers no matter where you go? So the big question for us has been, can we improve care continuity and quality by enabling patient management of their clinical and non-clinical health data? So the box on the left is basically showing a bunch of technologies that we've developed to make this all possible, what we call the digital health wallet, and there's some publications on that. But I think most importantly, we worked really closely, starting with just doing a landscape analysis with the Kenya Health Federation and working with a smaller local health facility that's doing amazing work in a community in Western Kenya called Lawala, to understand what are the health providers' needs and the patient needs in a specific domain. In this case, it was looking at chronic conditions from HIV comorbid with diabetes and or hypertension. And now to move into a clinical study, we collaborate with the Kenya Medical Research Institute and now work in a broader set of hospitals to study the technology that we have developed. So that kind of gives you a flavor of how IBM Research engages in developing new technologies in the healthcare space, leveraging what we're good at. So that's like AI, cloud technologies, blockchain, and many others from a technical perspective and computing perspective to address these problems with partners. And I want to definitely acknowledge the team that I work with, who've done an incredible job, stayed focused very much on the ground here, and also across a few of our labs globally. And that's it. Thank you very much. I appreciate your time, and I look forward to engaging with you all through this series. Thank you.
Asante Sana, Twitter handle @IBM Research.